Hello, I am Teresa Ariano. I am one of the special education teachers here at Kyrena Traditional Academy.
Hi, I'm Cassidy Hind. I'm another resource teacher at KTA.
Hi, I'm Stephanie Leary. I'm the middle school resource teacher at KTA.
Hi, I'm Sarah Schulhauser. I'm the speech therapist here at KTA.
Hi, I'm Brittany Thompson. I'm the school psychologist here at KTA.
Hi, I'm Jen Wolf. I'm the school counselor here at KTA.
This is our slide this evening for exceptional student services that are provided here at Kyrene Traditional Academy. As you just seen, you went ahead and you met our team here of our elementary teachers, our middle school teacher, our school psychologist, our speech language therapist, and also our school counselor. On this slide here is our general information by contacting us either by phone or by email. Email is the best way for us to be contacted because we do check it often throughout the day. Our typical service model here for elementary school is we do meet students for 30 minutes in small groups as outlined in their IEPs. And in the middle school setting, it is 50 minutes, 4 days a week, and 30 minutes on Wednesdays. Elementary special education services are primarily supported through small group pullouts where we work on the goals written in each student's IEP. Students are never pulled during core academic areas. In fact, KTA has ensured that all special education pullout supports are performed when students are doing small group learning in their general education classrooms. The special education case managers work closely with the general education teachers to provide accommodated work and behavior supports to students that require special education services. It is truly a team approach to student learning. We will meet annually to update IEPs. IEP progress reports are posted in parent view along with the report cards quarterly.
Middle school special education services look very different than they did in elementary school. In middle school, the ELA and math general education teachers and special education teacher work together to co-teach the general education curriculum. The students are not pulled out to receive their supports. Students will be provided with accommodations and tools to be successful with the grade level content. For science and social studies, we strive to provide an aid for support with content, but this is not always possible unless specifically written in a student's IEP. We will continue to meet annually to write a new IEP for students requiring special education supports. IEP progress reports are posted in parent view along with report cards quarterly.
Speech language pathologists at KTA evaluate and treat children who have difficulty with speech or language. We support the following skills at school. We look at the way students are producing their speech sounds, that's called articulation. We look at phonology, the speech patterns we use. We sometimes look at apraxia, which is difficulty planning and coordinating movements needed to make speech. We also look at stuttering and voice. For language, we look at receptive language, how students understand language, expressive language, which is how students express themselves, and pragmatic language, which is the communication we need to socially interact with each other. Speech therapy looks different depending on each student. Sometimes it's provided in individual sessions or in small groups outside of the classroom. We can also provide consultations with staff members to support student needs in the classroom. Your students' communication goals are updated annually at IEP meetings, and you receive quarterly progress reports through parent view when report cards come out.
As the school psychologist, I get to consult and collaborate with families, teachers, administrators, and school-based mental health professionals to support students academically, behaviorally, and social-emotionally. As a school psychologist, I work with students both indirectly and directly. Indirectly, I support students through collaborative teams that gather and analyze data to make decisions on behavior and academic interventions and monitoring tiered levels of support. I also get to work with a team for completing psychoeducational evaluations for students suspected of disabilities with their education. I also work directly with students by completing IEP counseling. So this could be done in small groups or one-on-one. We practice social skills, coping strategies, and other social emotional learning skills. Overall, my goal as a school psychologist is to support students' ability to learn and teachers' ability to teach.
As the school counselor, I am committed to the student success for all students by providing programs and services that enhance academic, social, and behavioral development. I get to provide direct student services by planning and organizing and delivering small and individual counseling, and providing and supporting prevention programs and the use of strategies such as check-in, check-outs, and restorative practices. I develop and deliver structured classroom lessons on relevant topics based on data or need, and I work within a multidisciplinary team to complete risk assessments and determine response. I also provide indirect student services by coordinating support services to students and families to remove the barriers to learning and promote positive family-school relationships. I monitor suicide risks and other risk factors to provide referrals to families. I facilitate transitions for students and families between elementary, middle, and even to high school for the new students during that school year. I participate in MTSS 504 and IEP meetings as needed. Along with that, I provide program management and school support by reviewing and using data to determine the focus of counseling and prevention supports for the school and for individual students. I help with training and support for school staff and family on all risk factors. I'll oversee risk assessments, monitor implementation of school counseling and prevention programs to help make adjustments based on our data, and I participate in all school-based meetings and district trainings as needed. We look forward to working with you and your child. Thanks for watching our program from the KTA's ESS team.